Hello.
Hello.
How are you, firstly?
I'm good, thank you. How are you?
I'm all right. So, we're here with Dr. Saiqa Shah, and we're going to talk about her reflections on care and compassion in some of her work choices. So, could you please introduce your work experience to date in the health and care sector?
Sure. So first of all, thank you for having me. My experience in the healthcare sector has been quite varied. So I started off working as a psychological wellbeing practitioner, and now that involved quite a lot of work around CBT. For most of you that don't know what CBT is it's cognitive behavior therapy, where you deliver therapy to patients who are suffering with various mental health disorders, from anxiety, depression, panic disorder, and so on. So I've been doing that for a number of years now, and then once I started working as you could say, a CBT therapist. I then went on to pursue medicine, which was training to be a doctor. And that involved me to work in the UK as well, but also travel to Ukraine, where I was able to secure an internship working across various hospitals, which included military hospitals, private hospitals, and governmental hospitals. I also had the opportunity to, you could say, teach, you could say, in orphanages for young children who didn't really know English, and teaching English at a kind of, you could say, varied level, just not for children, but adults also.
That's cool.
But
Very
that also,
interesting. Go on, sorry.
I was going to say, that also involved me to learn a bit of Ukrainian and Russian, which was a bit of a struggle, but I got by.
That's awesome. That's very interesting. Thank you. So, how was it changing from working in CBT in UK to going on to work in Ukraine? What were some of the differences that you found?
Um, Obviously, the difference was probably environment, language, and the culture. But at the same time, I would say the UK is very much equipped in healthcare, whereas in Ukraine, I saw quite a lot of limitations where people are not able to access healthcare as readily. Hospitals were not very much equipped with latest technology,
Mhm.
but also at the same time, there's quite a lot of, you could say, strength and unity amongst
Mm.
Ukrainians, where they battle through every challenge and disease. And it kind of made me more resilient, you could say, as a medical doctor, but also showing a different, you could say, way of compassion and empathy. In the UK, empathy and compassion, you have to be very, you could say, sensitive to certain patients, whereas
Mhm.
in Ukraine, I would say, um, you had to be sensitive, but at the same time, they didn't want you, you could say, probably feeling sorry for them as such. They wanted you to kind of be tough on them and make them more resilient, and be like, no, I don't want the pity, but I want you to kind of make me more strong, and how do I fight this? So that was quite a nice, you could say, transition into me kind
Yeah.
of being more, you could say, a militarian approach at times.
Okay, so do you think that translates your experience how patients want to be treated in Ukraine to patients here after you came back to England?
I'd say it's slightly different. Whereas patients here, want you to show a little bit more compassion and
Mhm.
sensitivity, and trying to understanding their problem more. So I
Mhm.
felt over here, you know, patients were, but you don't understand what I'm going through because you haven't suffered it. So kind of going the way around that, and how
Mm.
you would empathize with them and reassure them that you do understand their
Mm.
pain, you do understand what they're going through, but how you would go about explaining that to them, but also gaining that trust factor from patients that, you are not just there to treat them, but you're being there for them, as a person, to rely, for support on, where if I'm not able to support them in the best possible way, how I could get other organizations or professionals to help them as well.
Yeah. Okay. What sort of patients did you have in Ukraine? You mentioned different settings, but what kind of patients were they mostly focused on? Elderly or ones with mental health issues, that sort of thing?
I would say more, you could say, middle-aged elderly. It was more around respiratory
Hmm.
and infectious, diseases. I think COVID was quite prominent, or
Oh,
coming
wow.
into, at that time.
Mm,
So, it was more about, kind of taking care of themselves, washing your hands
hmm,
properly, wearing your
hmm,
mask properly, because, I think in Ukraine, everybody was very much like, we don't have to really wear a mask. We're just going to
mm,
go out however we are,
hmm,
but kind of teaching them that no, you have to
hmm.
take, health seriously. You have to
Yeah,
protect
yeah.
yourself and members of the population at all times. So teaching that, to them, was kind of interesting. I wouldn't say it was a challenge as such, but making sure that they, taking safety, measures at all times, really.
Hmm. What do you think some of the benefits have been for you from working in these interesting jobs? What have you
I think
gained?
it's definitely, opened avenues for me to work probably as in the academics area of now working as a lecturer, where I feel as though it's brought quite a lot of diverse skills, probably that I would want to, pursue further. So
Hmm.
for me, I didn't think public health would be an area that would interest me so much when I started my medical career. But
No.
ever since I've gotten into it, I think this would be, the perfect career that I've always wanted.
Mm,
It's just, nice to see the changes and challenges I've faced, but now how public health is probably, an integral part of my career,
mm.
which I would probably want to pursue as a lifelong career now.
That's awesome.
Thank
Uh,
you.
And what was your initial training? What was your first degree? So, what are some entry requirements basically into being a CBT
Sure.
therapist, for instance?
So I did my, degree. Firstly, I started off in early childhood studies, which was psychology related, but it also had obviously teaching, elements into it. Then I went on to pursue a master's, which was an MSc in developmental psychology,
Mhm.
that kind of opened up avenues for me to get into research. So I
Mhm.
worked as a research assistant and a clinical research officer in the area of psychology. And then whilst I was doing that, I did some training in, CBT therapy, which would be, postgraduate training into low intensity or high intensity
Mhm.
therapy. That's a year long, where you could do alongside your job, but then that gives you the
Okay.
qualification to kind of train, as a CBT therapist or deliver CBT therapy, to that level.
Okay. Interesting. And what would you say is your current, having had those various experiences from research to CBT to work in a completely different country and environment? What would you say? How do you see person-centered care now? What's your view of it, as it were?
I would say my view and person-centered has probably become, um, you could say, part of my, not just my academic
Mm,
research that I'd like to go into, but also, my daily practice, where I just think it's so integral, um, the way we approach people, the way
mm,
we approach patients in the community. And I would say it's definitely made me more a community, driven,
okay.
professional, where I'd like to be at the center of the community delivering, you could say, patient centered approach, because I get that
Mm,
opportunity to speak to people, on a face to face level. And I think that is something that I really enjoy, learning people's story and their history, their medical
mm.
history, and how things impact them, and having that conversation with them. And that makes such a difference to patients, having that quality time with them, which I don't think they really get when they go in for a 10-minute or a few minutes GP appointment.
No, absolutely. It's very short, isn't it?
Mhm.
Like 9 minutes on average, I think I read.
or even less.
Really?
Sometimes it
Mm.
is very dependent on like the demand and how
Yeah.
many patients they have on the waiting list as well.
Thank you. So to finish off, my last question is,
Mhm.
what's next for you? What's your plan?
So my
In an
plan
ideal
is
world, what's your plan?
in an ideal world, my plan is to obviously, I'm loving lecturing at the moment. It is great, but I would like to go into research. I would probably go back to training into medicine. So, training as a consultant. The
Oh yeah.
plan is to train as a consultant in public health, and maybe do some research alongside, do some teaching. Who knows? It's just a vast
Wide
of
open.
opportunities, but it would be something that I would say public health and medicine related that I would go down to.
Okay. And would you ever continue studying? Do you want to do a PhD or anything, or
Why not?
why
Why
not?
not
Okay.
get keep? I don't think study never ends. When you go into this line of profession, you're always learning, and I think why not? If you get the chance to do a PhD or a qualification, it is just extra knowledge, and that can help you so much in your career, lifelong. It never goes to waste. So yes, I would definitely not turn down that idea.
Fabulous. Thank you very much.
Thank you very much for having me.
Okay. Transcription has stopped. Hang on.